just to kind of preface this for our students who will watch the recording, my thought about having this session is when I became a teacher, like a lot of this stuff was very foreign to me. And while I went through an HR benefits session, I feel like there were a lot of things that, they kind of were like, oh, and this is what your, you know, health insurance premiums and deductibles and out-of-pocket maxes and all of this stuff that they sort of walked me through. But I didn't really feel like I had an opportunity to be like, I don't actually know what any of those words mean. And I like sort of understand what they're getting at, but I don't actually know some of that. And I don't know that I don't know that this is necessarily specific to teachers, because I think there's a lot of folks that get out of college and they go through these HR sessions and they don't really know what a lot of this stuff means. But yeah, I think that's helpful too. And then also kind of some things around just general practices that I think a lot of people think of as like common knowledge. So things like, when can I change my preferences for, which plan I want. And for instance, my husband and I last year had to determine, we had an open enrollment period, but I had to choose my benefits before he actually even knew what his benefit options were. So it made it kind of difficult to make that decision. And I didn't, even 15 years into like being a working person, I was like, wait, is that legal that they can, do open enrollment at different times during the year and that kind of a thing. So that was just to kind of preface it. I think there's just kind of a lot to know and even knowing what questions we have, who to ask those questions to, kind of a framework for understanding what benefits look like. And I don't know that this is, like I said, necessarily really specific to teachers. So, like I've been in a couple of jobs outside of teaching now. And I don't know that a lot of that is super different, but I just thought like a framework for that would be really helpful for our students, if that makes sense. So yeah, I think if we can get into that, like PTO, sick time, because I think that was another thing is that looks kind of different in different districts too, where sometimes you just have PTO and you just use it for whatever you want to use it for. And then sometimes there's a little bit more stricter rules around like sick days are actually sick days and not for PTO and that kind of thing. So I think all of that will be helpful for us. And I have some questions, but I'll just kind of let you take off. And then, excuse me, Adrienne and I can just kind of ask questions as they come up.
Okay. Do you want me to start?
Yeah, sorry.
Okay, so you should see a screen that is our employee benefits guide. And as we were just talking about open enrollment, you'll see that this guide is updated for January 1st, 2022 through December 31st, 2022. I will tell you that so West Data is currently in our open enrollment period, as we were just talking about, an annual period. And West Data is unique. I think I talked a little bit about last time, but we're probably the only school district in the state of Idaho that has their benefits on a calendar year basis. Traditionally in Idaho schools, their benefits are based on a September 1st to August 31st basis. The reason for that aligns with more on how teachers are paid and teachers are hired. It also is easier to budget since our fiscal year ends on June 30th. I was involved in making this decision to change it. So since we're a unicorn, I still think I defend it very heavily and thinks it's a lot smarter because it aligns with other tax benefits that employees have that are based on a calendar year that we'll talk about, such as flexible spending accounts and deductibles and things like that, that most of our employees operate on a calendar year basis and not on this fiscal year basis. And when they have all of a sudden their benefits stop on August 31st and then deductibles start all over, it's problematic. So just know West Data is unique in having this time frame for their benefits. We produce a guide, actually our brokers produce a guide for us, and it answers a lot of questions on where to go. So we have my staff is listed here and who they can call, what their roles are. Our brokers, our account managers listed in here. And then we have from all of our different carriers, we have their contact information in there. So it makes, we think, and we get a lot of these printed that we give to everybody when they come to work for us. In that, in our orientation, if you will, where you're overfed information that you're never going to remember the day you walk, the second you walk out. But so we give them something in pages. Not all districts do this, but this has been really, I think, a helpful tool for our employees. It does tell who's eligible. So generally, anybody called a full-time employee is eligible for benefits. The challenge becomes the definition of a full-time benefit employee and how that works. With the Affordable Care Act that you may have heard about as Obamacare, it changed the game for us a little bit because there potentially was benefits outside that were available through the Affordable Care Act that people could qualify, but also if employers had plans that were affordable, it would disqualify their entire families from being able to have those benefits. So we changed ours that in our plan, if you were a teacher or an administrator, you got to be at least a 0.75 FTE, or you have to work 30 hours a week to be eligible for benefits, for medical benefits. If you're a classified employee, state statute requires us to provide the same benefits for classified people that we do for certified staff that work 20 hours per week. And the 30-hour week per week magic is because that's exactly what Affordable Care Act is in the Affordable Care Act, employers only required to provide medical benefits to employees that work 30 hours per week. So we had that change. Prior to the Affordable Care Act, it was always 20 and 20 for that. So that just kind of talks about whose benefit, when they begin, what our waiting periods are. The other thing that we were talking about, enrollment, we talked about enrollment periods. So generally, when you come to work for somebody the first time, that you're going to have a free shot to enroll in any benefit that they have generally, regardless of your health condition. So life insurance, disability insurance, medical insurance, which now doesn't really have decisions, but anything that potentially takes some sort of medical analysis, when you first become employed, all that is generally waived and you can get insurance. So you could be diagnosed with stage 4 terminal lung cancer and get a job, and you can get life insurance like anybody else. That's an extreme example that probably is never going to happen, and that happens only when you get hired. So if you choose not to take something, generally you will be disqualified from getting that in future enrollment periods without having a medical qualification, and they could disqualify you. So that's important. But the other thing that does happen is we have this enrollment period that is a set time. And in West Ada, we always do our enrollment period from November 1st through the first Friday in December. That's our standard enrollment period, open enrollment period. And that is, again, because we renew on January 1st. So we need to know in December for January how that's going to work. But throughout the year, individuals have their own enrollment periods. And it has to do with, going back to Melissa's question earlier, that it really wasn't the way, or shouldn't have been the way you described, because there's qualifying changes that create a new enrollment period for you. And when you enroll, the enrollment period is if you choose a benefit, you're going to be locked into that benefit for that year. You can't just disenroll and say, no, next month I don't want it, change my mind, you're enrolled. However, there's certain events, family life events that could happen. You get married, divorced, or separate, you have a baby, you change employee status, either you, your spouse, or your dependent. A dependent becomes too old or doesn't satisfy eligibility, you move to another state, other plans, you get change in coverage under another employer plan. So if your spouse's employer changes or some other change, you could create it. And every time that happens, you get, any of these events happen, technically you get a new 30-day open enrollment that's just your open enrollment period where you can make changes. And again, I'm getting maybe too technical, but just know that there is an open enrollment, but there are certain events that could happen that could create a new enrollment period, open enrollment period just for you. Does that make sense? Okay. We do have, talking about this, you're going to hear a lot of language and terms that you may have not known. We define those in here on what a copay is, what a deductible is, what coinsurance is, what out-of-pocket maximums are, who are preferred provider organizations, what is in network and what is out of network. So basically, a copay is if you go to the doctor's office and your plan has a $20 copay, let's say, that's very common, you're going to have to pay 20 bucks and that's it. And the rest of it is covered by insurance. A deductible is an amount that you have to pay that's above and beyond all of that. So let's say you go and you have a surgery, for example, and in that surgery situation, you're going to pay that cost wholly up to your deductible amount. Once you reach your deductible amount, generally there's a co-insurance amount, and that gets to the same amount. And typically in plans, you'll see an 80%, 20%, or a 70%, 30%. Sometimes, rarely, you'll see an 80 or a 100 zero, but let's just use an 80 100. So if you've met your deductible, so you have a $500 deductible and you have a $10,000 bill, you're going to pay the first $500. Then on the next $9,500, and you're going to pay 20% of that $9,500. So you're going to pay $1,900 if I'm doing my math right. That $1,900 plus your $500 deductible become part of the computation for the out-of-pocket maximum. Because if you have then a $2,000 or a $5,000 or a $3,000 out of pocket, once you've spent that much money, everything gets 100% covered for you. So that's how that works. Preferred provider is generally in Idaho, you're only going to see PPOs. The opposite of that is what's called an HMO, a health management organization. Basically, a preferred provider means that you can select your doctor. The simplest way to describe it is you get to choose your doctor under the plan. In an HMO plan, and we do have a dental HMO that I can talk about, is you just go to that organization. Let's say, trying to think, Kaiser Medical in California or something like that, that they have an HMO. Well, if you're gonna go to the doctor, you're going to Kaiser, and you don't get to choose who your doctor is. You're just gonna go there, and you're gonna get who you get. That's what an HMO is. In Idaho, HMOs don't really exist. We just don't have the population to support them and support hospitals or medical facilities that way in any great length. And then network and in-network and out-of-network has to do with how the insurance company contracts with medical professionals. Again, in Idaho, because our population is so low, we really only have 4 medical insurance companies. We have Blue Cross, we have Regents, we have Pacific Source or Pacific Health, and we have Pacific Source, and we have Select Health. Select Health is a St. Luke's kind of affiliated company. Pacific Source is based on the Northwest. For West Ada, our really only choices are Blue Cross and Regents because they have a broad enough network. So if it's in network, that means your insurance company has contracted with that doctor and has agreed on rates that they're going to accept, the doctor's going to accept, and the insurance company is going to pay. If they don't have a contract with that provider, it's out of contract, and you'll see later the benefits are generally not as generous if you go to an out-of-network doctor versus an in-network doctor. But in Idaho, in the Treasure Valley, Regents and Blue Cross pretty much have everybody in network. It'd be rare to find, it happens, but it's not often you're going to find an out-of-network doctor. You can usually pick whoever you want to go to. This is our plan. So you can see in West Ada, we have, and it's divided into 2 columns, gives you all the details. I won't go through them in here, but you can see we have a $500 individual deductible, and we have a $1,000 family deductible. So what that means is if I have my family on the plan and I have a child that meets the $500 deductible, and then my wife meets the other $500 deductible, 1,000 is the max. Let's say I have 5 kids, 5 people on the plan. I don't have 5 times 500 or a $2,500 deductible. It gets capped at 1,000. Our out-of-pocket maximum for medical is $5,000 for the individual and $10,000. So it has the same cap that only 2 people have to meet that, or a combination of everybody getting to the $10,000. And the same thing with the $1,000. It doesn't have to be 2 people meeting it necessarily, but that you paid $1,000 as a family in deductible. That's for in-network or out of network at $6,500 and $13,000. This is the coinsurance that we talked about. We have at 80%, 20%. If it's in network, if it's not, it's 60-40. So basically, you're going to be paying double if you don't go to one of our network doctors. We do have a copay that we talked about earlier, that we have a $20 for primary care. Preventive care is totally covered. For chiropractic, we have a higher copay. For rehab, we have another higher copay on that. And then it just kind of lists all of our services. Then prescription, again, one of the things that was different for because of the Affordable Care Act, we never had out-of-pocket maxes on prescriptions, and the Affordable Care Act requires that now, and employers are required to have there's a maximum that you can have an out-of-pocket cost. So our prescription is $1,500 individual, $3,000 per family. We have a $10 copay, then 20% if it's in network. If it's out of network, is 20 and 20. Mail order is 10 if it's in network, and 20 out of network. And then this side is for the out of network stuff. So these then give our rates. You're going to see districts have different rate structures. When I came to West Ada, we only had 3 structures. We had an employee plus one other person, and an employee plus 2 people, which is basically family. And what happened is we do have a lot of single parents, and it became very, very costly for them to insure their children. And so we went to this structure where we had an employee plus a spouse, and basically the spouse is what an employee costs. So in this case, when an employee pays $35 a month, the district is paying $723 a month, is contributing for your insurance. So this is our plan is very, very inexpensive for employees, and a very, very rich plan. And then employee plus spouse, and then we have these layers where if it's just you and a child, it just costs you another $179. If it's you and all your kids, it's $339. And then you can have just you, your spouse, and one child or family. So we've tried to gradiate that to make more options for our folks. This again kind of lists the preventative care benefits. We have Should I start for questions on medical insurance? Do you have any questions specific? Sorry, Melissa.
No, that's okay. I have a couple of quick questions. So this is a monthly, back to the monthly rates. It's so for their spouse and child, they're paying like $903 per month for that.
Per month, correct.
Okay. Yeah, that's not like it's interesting to look at that because the employee is just $35 by themselves. So that jumps up pretty quickly. And is that pretty typical?
It is in Idaho. So and this was one of your questions where you wanted to talk about high deductible plans, versus, not necessarily PEO, but really it's high deductible versus low deductible. It weighs in your question on health savings account versus a flexible spending account, or an HSA versus FSA. So there are districts that I know around us that have different options. I will tell you, West Ada, this concept of a $500 deductible and a $5,000 out of pocket is this is as rich of a plan as you'll see in school districts in the state of Idaho. I think most school districts, you're going to see that deductible as $1,000 would be low, $1,500, $2,500 deductible. We have kept that rich. That can be a plus and a minus. I mean, it's great for employees, but what ends up happening, the reality of life is people that are old like me, and thankfully I'm pretty healthy, are big users of medical services and the insurance. And then young kids right out of school never darken the door of a doctor's office on the deal. And so what ends up happening when you have a rich plan like this and don't have other offerings is these premiums are what pay those costs. And so the young, healthy, let's just say it that way, or let's just say healthy. I would differentiate because I'm pretty healthy too. So let's just say the healthy end up supplementing those costs. And we have looked at, and I don't know, how other districts have necessarily been completely successful. We have looked at, should we have a high deductible plan that would be a much affordable cost for families to get into? And the problem that happens on doing that is the cost of this plan would probably triple to make that work, because you'd have, again, I would tell my kids, I would tell all this, go to this high deductible, keep your premiums low as possible, put your money in a health savings account and self-insure yourself. And so those are options that are available with other school districts. We've not chosen to do that. It is hard because medical insurance is very expensive for all of us. And you can see that if you take the 35 out of this 758, that's the 723 that West Ada is contributing for each and every employee every month to make this 35. But then once this is, we don't pay any more. Now, other districts do contribute more. You can see on the news that if you work for the state of Idaho, they have a plan that's a very nice plan, and they contribute much more to dependents. West Ada has not contributed to dependents on medical insurance for quite some time.
Okay, that makes sense. And then I guess, so you just have the one plan. It's not like they can choose. They're not really making any decisions here. It's just like whoever you have.
Well, for medical insurance, we have only one plan, and they would choose to take it or waive it. That's their only choice.
Okay, gotcha. And then, so when that high deductible plan is potentially offered, if they were at a different district, is that a number that usually is talking about? Is that like $5,000 deductible, or what is typically like a high deductible?
Well, high is a relative word, right?
Right. Yeah.
So, the term high deductible is a specific term generally referred to plans that qualify for health savings accounts. And so I can't remember. I think that number is about $5,000.
Okay.
I don't know off the top of my head what that is. And what happens with that is if you have a high deductible plan, you can then take, the theory is you take the difference in premium, what you would pay on a regular deductible and the high deductible, and then you put that money in a health savings account. And then that health savings account can come to supplement that deductible when you have actual medical costs.
Yeah. Okay. That makes sense. And so, yeah, I guess to summarize that for folks is like, in that case, you're sort of balancing, like it's an inverse relationship between your premiums and your deductibles. So if you have high deductibles, you're going to have lower premiums. If you have higher premiums, you're potentially going to have lower deductibles. So if they wanted to keep this down and they had the option, do you see a lot of folks who, like, I'm looking, like, this seems like a little bit more affordable if you don't have a spouse on the plan, whereas like, your children are a little bit more affordable. Do you see a lot of people saying, like, if their spouse has another job, to just get insurance through their other job and just put the kids on this insurance plan? Is that?
Yeah, that's exactly what has happened. We never had a lot of spouses anyways, but again, my personal situation, my wife has a job and she's not on our plan. She's on her plan specifically. And so we don't have a ton of spouses. We don't have a ton of families. And again, when we moved to the employee plus child and children, that was very, very popular for our folks. I did display single families because that was kind of our intent was when you had single parent households, but it works the same for a married couple too, that both work, that, they can put the kids on our plan. It's fairly affordable. They're only going to pay $144 more to add a kid, or $334 more or $304 more, to add all their kids. So yeah, that's exactly correct.
And I think also, like, when I moved to Idaho, I was really surprised by a lot of insurance plans, just because I've lived in several other states, and I was, as a teacher, just for myself, was always paying about $130-ish a month for my premiums as a teacher in other places. So when I was looking at this, and then I think also just outside of the public schools, there's a lot of jobs that completely have like no premiums. in Idaho, which I think is pretty unusual. And I hadn't seen that before, but I don't know if you know more about that. Like, is there something that makes that happen more in Idaho or?
I guess I don't know. I know, again, same thing. I worked for different employers and had things change over time on responsibility. And as you know, when I started my career back in 1985, tell you how old I am, before all these kids were born by a long ways. I, you know, that's when insurance really started going up significantly, and employers that I had kind of froze how much they paid for the employee and did that. But I would, in school business, this $35, that's why I say it's a very, very rich plan that you get all these benefits for $35 a month. And so I don't know if it's common. I know that as far as government employment and school employment, there is a concept, and we maybe talked a little bit about that the pay is not that great. You can go work for the private sector and make more money. And so one way that we try to compete on a better way is to have benefits that are better. And we talked, talked about Percy and things like that are better than you're going to get in the private. That, again, that doesn't buy hamburger for your meal tonight or your gas for your car tonight, but it does provide something. And so I'd say overall, the government mentality and in the state and even school districts, I think, do have an option that, our compensation is not as great as we would like it. And so we've got to really try to offer good benefits to offset that and attract good employees.
Yeah. Okay. Yeah. Sorry, that was actually more than a couple of questions, but Adriana, did you have any other questions for that section? Okay, cool. That helps. Thanks.
So again, this is just still affected the medical is what preventative care benefits are completely covered. We do want in the world of in West Ada, we want our employees to be good consumers of medical care. I would think as a society, we're not very good at that. We just go to the doctor and say, okay, I got to do that. And we think it's free because your insurance is covering it. Well, it's not free. But we do think it's good that our employees have doctors, that they go to annual exams, they do all those things. The younger you are, you're still immortal, I think, at some point, and then figure out that you are a mere mortal at some point. And so it is good to check our bodies and make sure we're good. Our plan also includes an employee assistance plan. And what this is this is services that we offer for free for our employees and their families. So there's a lot of things that can happen in a person's life, whether it be financial trouble, conflicts, legal issues, things like that, counseling. And this is a service that they have that they can call, their kids can call, their spouse can call, they can get counseling, they can get guidance on certain things. That's really, if they're going through some struggle, they have that. We do have a flexible spending account, which you referred to, and that. So a health savings account, just to define the difference, is an account that's generally related to a high deductible insurance policy that is money that you contribute to, that is your money, and you contribute it, you can access it, you leave your employment, you still have that money, it's all there. A flexible spending account is a different type of account that allows you to defer your own salary into this account. So you don't have to pay taxes on it. You don't have to pay Social Security or federal or state taxes on it. And then you can use this money to pay your out-of-pocket costs during a year. These do have some sort of risk because you determine how much you're going to contribute, and it's risk for the employer and the employee. And let's say you want to put $1,000 in there and you only spend $200. You don't get that $800 back. That just is a forfeiture in the plan and it doesn't come back. Now, thankfully, about 4 years ago, the IRS changed the rules and allowed plans to allow a $500 rollover. And so before it was a complete use it or lose it. Now our plan allows us that if you can get within $500, that $500 can roll over to next year and you don't lose all of it. So this goes into a plan pre-tax. You can, for medical expenses, you can put up to $2,750 a year. For daycare, this is for daycare, dependent care, you can put up to $5,000 in this. And again, so you're taking your salary and you're voluntarily putting in this, and that portion of your salary then becomes completely untaxed. It's a great benefit. I encourage everybody to do it as they can. And we, and I was wrong on the 500. So it's the IRS with cost of living, it's now $550 for next year that you can roll over from one year to the next if you don't spend it all. And then we get to our dental plan. So
sorry, is that the same account for medical expenses and dependent care? Like, because I think at BSU ours are separate. I think where you have to
two separate accounts, two separate elections, two separate accounts. Yeah.
Gotcha. Okay.
Yep. And then our dental plans. We have two dental plans. We have one that is with Delta Dental, and this is a PPO plan. So you go to whatever dentist you want to go to. Dental insurance, I will tell you, is not, I would argue in some ways it's not really insurance. You're just prepaying for services. The only time it's really insurance is when, if you really had some serious dental work like crowns or root canals or things like that, there is going to be a benefit. The benefit on dental caps at a certain amount. Like right here, you only get $1,500 benefit per year per person. And you have a $50 deductible per year. Our rates are pretty reasonable. And these are all, the employer doesn't contribute anything. $39 a month for an employee, $78 for an employee and one dependent, and $134 for a family. That's dental insurance. We do have an HMO, which is through Willamette Dental, which is a dental office here in town, dental organization. And the premiums are a little higher, but the costs are a lot cheaper. So when there is no deductible, there's no maximum annual benefit. Any cleanings, you just pay $15, that's it. Other basic service, you pay $15, that's it. If you need an implant, you get one paid 100%, up to $1,500. And then this is the big deal for our employees. As people have children and they raise children, including my own, oftentimes they need braces. Braces are generally not covered. Braces, seems like the number never changes. It's about $4,000. With my kids, it seems like it's close to $4,000 now, might be a little bit higher. And dental insurance generally does not cover it. In this plan, it does. It basically $1,500. So you pay $1,500 and all the dentist. So we have a lot of our young families use this specifically for braces for their kids as an option, where up above braces are, you get like a discount type of deal, but it's much higher. So, and then some, but again, when you go to Willamette, you don't get to pick the dentist. You just show up and it's whoever's on duty that day. That's kind of the HMO concept I talked about earlier. We have a vision plan. Again, vision is very similar to dental, that it's not really insurance. You're kind of prepaying for costs, but you do get an exam every year. You do get some benefits on contact lenses and frames every year, or frames every 2 years, contact lenses every year, and what your copay is, what your reimbursements are, and and again, it's very inexpensive, $6 a month for an employee. So if you need glasses like me, you always do this and you get a little bit of money back, but you're kind of, prepaying your money and then getting some benefit back. We have life insurance as a benefit for our employees. For all of our employees that are full-time employees, benefit eligibles, we provide a $50,000 life insurance policy for them at employer cost. For administrators, it's a $100,000 policy. And then we do have accidental death and dismemberment that's also covered by us. You can add in this policy, you can add your spouse, you can add your child, very nominal amounts, and this is all covered by the employer. We also have voluntary life, where you can add additional life. So this is one of the coverages I talked about earlier, that if you sign up when you get hired, there's no questions asked about your health. But if you try to do this during open enrollment, you're going to have to qualify based on your health condition and understand an exam. And then this just kind of gives you rates. It's banded based on your age. Again, the risk of dying increases as we get older, unfortunately. So when you're young, it's pretty cheap per thousand. When you're older, it's a lot more expensive per thousand. That'd be a good stock play from 8 cents to 322. So that's our life insurance. So this is also another thing that's unique to West Ada and not really popular yet with school districts. I don't know of any school districts in the Valley that offer disability insurance as a benefit. The old way and the one that is still common in school districts is they have a concept called a sick leave bank. And you can participate in the sick leave bank process, and there's rules and vesting. And so if you really did have some illness that caused you to be gone for a long period of time, you would access that sick leave bank. West Ada 10 or 12 years ago went away from that, and we do offer short-term disability and long-term disability for our certified staff. But for our classified staff, we pay 100% of this premium for all of our classified staff. For our administrators and our certified staff, it's a voluntary benefit, and we contribute up to $12 per month of this premium, and then you pay the difference. So you have to choose to do it. Short-term disability generally lasts for 6 weeks. It's for short-term disability. So the most common claim is with our female employees that have a baby, and there's a time when they're out and they access this short-term disability, so they don't have to use their sick leave. They can protect their sick leave, and they get compensated for this. We also have a voluntary long-term disability, and again, it's 100% paid by the employee, and this would then cover you after your short-term disability if it's a qualifying event. So there is, definitions of what disability is and what you can and can't do, and you have to qualify for this when you make a claim with the insurance companies. But it could go for, this could go for a long time, protect you for a long time. And there is arguments in the insurance business that, especially when you're young, there's a much higher likelihood of you becoming permanently disabled than dying. And we oftentimes don't tell anybody that they ought to have, insurance people sell you life insurance all day long, but your chances of dying are much less than becoming permanently disabled. So that's an option that we have that's voluntary for our folks, and then it has the rates on that per rate. And this rate is age banded, and it's also based on your salary as well. Any questions so far on those benefits?
I don't think I have any. Do you have any?
Just one quick question regarding the health savings account. So you were saying that that's money that is the employees, even if they don't use it, can they take it out and just walk away with it, and does it have to always be used for health related purchases or expenses?
Okay, so the health savings accounts, the analogy is to like an IRA. If you're familiar with the individual retirement account, which is similar. So it's your bank account, it's in your name, but it's in this health savings account. The answer is yes, you can take it out all and spend it however you want. However, there will be penalties when you file your tax return. There's going to be a certain, probably it's 10% penalty on anything you take out, plus you're going to pay tax on it when you take it out. If you just do that. Generally, it's intended to be used for qualified medical expenses. So if you take the money out to pay a doctor's bill or to pay for a surgery or to pay for prescriptions, then that's not taxable, no penalties, no anything. Again, the big benefit is if you change employers and they don't have that account still moves with you, and you can still use that money to pay medical expenses. But the short answer is yes, you can use it for anything, but there will be penalties. There are some exceptions I think there's actually some exceptions for buying a house. If you had a financial emergency, there are some exceptions to that penalty situation with those, but generally it's intended to be paying for medical expenses.
Okay, thank you. Yeah, I've never worked anywhere that I'm aware of that had like a health safety health savings account option. I don't think Boise State has one, right, Melissa? You probably know a little bit more about that now.
Coming out, yeah.
Okay.
No, we just have that FSA option. Yeah, and I think you said this already, but the district doesn't actually help you at all with that, right? Like they don't, there's no contribution from the district. It's just 100% from the employee for the FSA. Did you say that earlier?
Yeah, for the FSA, we don't make any contribution to that
Okay.
at West Data. And but for other employers, they could choose to employ, to make a contribution for the employee. And the same with the health savings account. That is not necessarily have to be completely funded by the employee. Some employers, as a strategy with their insurance, will, they go to a high deductible, lowers their premiums. Well, they take some of that savings and share with the employee in their health savings account. That happens often. I'm a board member of a nonprofit here in town, and we have a health savings account and a high deductible plan, and we in fact do contribute for the employees in that plan, a portion of that.
Yeah, my last employer gave us I think a little over $100 a month from the employer. So it was essentially another like $1,200 that was essentially just added to your salary, which is just like something to kind of keep in mind when you're looking at benefits packages, for students, that's like not necessarily part of your salary, but essentially, they're giving you another $1,200 a month if that is, like part of their benefits package.
Yeah. Okay, so what did I do here? So the rest of this really has to do, and this is we do have other things, like you guys have heard of AFLAC, easy for me to say, AFLAC and American Fidelity and something like that have other insurances that do this. We have negotiated different things with those processes that if we let our employees choose from that they pay for certain things that keep our costs down. And so a lot of these are critical illness coverages and things like that. All our employee ranges and things that really aren't part of our benefit, but they're offerings that we provide for our employees. We do in this benefits guide go into PERSI and tell them a little bit about what PERSI is. We do talk about the PERSI choice account. I think did we talk about this last time? On retirement, did we talk about retirement benefits, or you guys had another class on retirement?
We had another session about PERSI. I think they talked about briefly. They just said that you have the option to contribute more through that 501 401k choice plan.
Yeah,
I think
PERSI choice,
right, Adriana?
Yeah,
I think
yeah. And then we also have 403b and 457b, which again are plans very similar to 401k, but they're specifically for government and nonprofit employers on that. And then there's slight differences between 403bs and 457bs. And then West Data, we have a rule, you can't just go buy John Doe's 403b plan. That we're not going to do a payroll deduction with you, just with anybody. So we have 403b providers that have met whatever requirements we set. Generally, we got to have at least 20 employees interested, and these are the contacts. We have certain pre-tax, after-tax, Roth 457 after-tax, and then we give all our all of our contact information for our employees in there. We are going to brand new today. We're going to an online enrollment. We've never done that. We've always done this not. So we now have new information about our online enrollment. And that is our benefit plan. But the other thing, can you still see my screen? That has a negotiated agreement. So that's kind of the benefits, the tangible benefits that we have. The other thing I did want to talk a little bit about, when you ask the question on where to go. So in most school districts, not necessarily charters and probably not private schools, state law does give the teachers union certain rights to be able to participate in processes. We do have a teachers union that's called the West Data Education Association. They do have to prove to us On a semi-annual basis, we do that they represent 50% plus one of our teachers. So they have a seat at the table to negotiate this agreement. And this becomes our agreement really, and it only applies to certified staff. So our teachers, if you will, counselors, nurses, things like that, on what happens. And this does go through details, it talks about, I think I talk about all the time about our salary schedules and things like that, but we get into our benefits where we do talk about our insurance, and we talk about what the premiums are. We talk about who's eligible for these benefits, what we just went over. That's all identified in these. We do talk about our open enrollment periods. We do say that you can defer a portion of your salary into a flexible spending account. And then we do say that if a person leaves our employment and they want to get paid off early, that they'll not be paid their benefits after that time. We then get into our sick leave benefit. So this is another one where we provide a sick leave benefit. Some of this sick leave is governed because it does relate to PERSI. And in your PERSI class, did you talk about the benefit of unused sick leave upon retirement?
I don't think we did. They might have mentioned it briefly, but yeah, you can remind us.
Okay, so in Idaho, in PERSI, any unused sick leave that you have when you retire can turn into a cash benefit at PERSI for you to continue to buy insurance benefits upon your retirement. Now, we talked, I think, a little bit, we have a huge benefit with PERSI that if you get into the teaching business right after college and you started right after high school, you could meet the rule of 90, which is full retirement for a teacher in PERSI at as young as 56 years old. Commonly in 57, 58-year-old range, you will have met the rule of 90. Well, you're still going to have to buy medical insurance for 9 to 7 years until you're Medicare eligible, which would then you'd have Medicare insurance through our Social Security system. This sick leave benefit is intended to be a way to bridge that gap, if you will, that you can use. So our retirees can retire and they can still buy our insurance benefit. If they were on our plan, when they retire, they can still buy our Blue Cross plan through PERSI, through their retirement with this, and they get this cash. The amount of that cash, and this is a school district only benefit. I don't believe you have it at the university. I know you don't get it at cities and counties and everything like that. Most other PERSI employers cap the amount of sick leave that you can accrue at 90 days, and that's it. So your benefit upon retirement is 1/2 of your daily rate of pay times the number of days that are unused. So if you had 90 days and you made, let's just make it easy, $200 a day, you would get 90 times 100 or $9,000 cash benefit that can be used at PERSI to buy insurance benefits. You can see our limit is 280 days. So I advise people, don't use sick days only when you need them. Don't just use them. Be very careful. Use your personal days. Use whatever other leave you can other than this to work, because it's a value. The other thing that occurred in the school world is when you transferred school districts in the past, you only could transfer 90 days. So if you had 250 days accrued and I moved to Boise School District, I was capped at 90 days. That law changed in the 13-14 school year, that for schools, they no longer have that limitation. So school districts can accept as many unused sick days as they want to accept, up to their maximum. So in West Ada, we do accept up to 280 days from another school district. This used to be a real golden handcuff on people, because that benefit can be $40,000, $50,000 for some people. And so they can't leave because they didn't want to lose, 190 days because they only can transfer 90, and that becomes significant money. So we give in West Ada, and this is in everybody's, so you find this in everybody's negotiated agreement. So currently we give everybody a day of sick leave for every month or majority of month they work. So for the majority of our teachers, that's 10 days. For me, that's 12 days because I work year round. For some of our administrators, that's 11 days, and some other teaching, counselors, things like that might be 11 days, but it's basically 1 day per month that you work, and then this is what you can accrue. We also have personal leave in West Data, and this varies. Our personal leave is based on how long you've been with us or what kind of contract you have with us. So basically, all certified staff starts out with 2 days personal leave, from day one. Once they become on a renewable contract, they then get 4 days per year that they get. And then we do have some limitations on usage. And we do also, if you don't ever use your personal days, we cap the amount that you can carry over to 6 per year. And any of those others, we pay you out in June at 1.5 times our sub rate. So sometimes people get upset and say, well, that's not what I make per day. I make more than that per day. Well, that's true. But many employers, it's a use it or lose it. If you don't use it, you just simply lose it. So we pay them 1.5 times, but that's on personal leave. And then we talk about other types of benefits of leave. We have leave if you just want to take a year of absence for parental leave and stay home with your kids. That can be done for our certified staff. There's some rules around that and who can do that. We do require that to be kind of a semester or a year basis. We did a lot of changement with our bereavement leave. So we have a bereavement leave policy, and then for certified, we have our bereavement leave in our contract. And basically, if you have an immediate family member die, we will allow you to take 5 days of bereavement for each of those deaths, and they're fully paid days. We also, we added some language to the who qualifies and being in there. We also added some language in this second part to include the ability to use bereavement leave when qualified family members at the end of life prior to actual death. Because we've had some situations that you have a grandparent or you have somebody that is dying and you want to go see them, and you might not do that. That wasn't technically allowed before, and so we just made clarification this year and allowed that. And then we also there are situations that we would grant additional bereavement leave, and oftentimes in West Data we've maxed that out per death at 10 days. We've not gone beyond that. That doesn't mean there couldn't be a situation that we did, but that's determined by myself. But often, if an employee loses a child, that's devastating. It's devastating. And so oftentimes they need more than 5 days before they can come back to work, if they can. We have some rules on professional leave and how that works. And then we have some other leaves that are really in policy, not in this contract. But that's really as far as leaves. As a teacher, you're most likely going to have a negotiated agreement similar to this that will define that for you, and that's where you find that information. So any questions?
I don't have any questions on the parental leave. I don't think, do you have any? One thing I just wanted to clarify, I know we're kind of up on time, so I want to just be respectful of that, but earlier you talked about classified versus certified, and I know when they're looking for jobs on the website, it uses that language. Can you just remind us what those words mean?
So in the school business, classified is any employee that doesn't hold a teaching certificate. Basically, any job that doesn't hold a teaching certificate or doesn't require a teaching certificate to be held. So my job is technically a classified job, although somebody could be in that role holding a certificate or not. I personally don't have a teaching certificate, so I'm a classified employee. So it's our teaching jobs, our school nurse jobs, our occupational specialists, physical specialists, counselors, school psychs, our principals, academic coaches, anybody that is certified. Everybody else is classified.
Classified. Okay, cool. And then is that something anybody can look up, the one that we were just looking at, or is that do you need to actually have been offered a job in that school district in order to access that?
No, both of those are on in fact, when I was right before this meeting, because I was a little tardy preparing, It was not on our intranet, which is you have to be an employee to get to our intranet, but it was on our outer facing. Yeah, so both of those are on our website under human resources, and find those there.
Okay, cool. And then my last question, I mean, maybe actually two very quick last questions. One is, I remember like I was working at Chicago Public Schools, which is like an enormous district. Is there any, like, is it difficult to get a hold of HR, or do you have any tips in terms of like how to get a hold of you if you have questions, like as an employee?
Well, I would like to think that it's not for us, and the Chicago Public Schools has substantially more employees than us, and a whole probably different governance basis. Since it's a unique district in itself in Illinois, we won't get into that, but
Right.
but our philosophy, my philosophy is we only exist to serve our staff. It's the only reason we exist. And so we try to really pride ourselves on good customer service. We have office hours that people can come to our office anytime, generally 7:30 to 4:30, 5 days a week. But also we have specific phone numbers for payroll, for personnel. And as you can see, we have all of our emails. And so I like to believe we're pretty timely, and we can get these questions asked. I will say that when we have, a lot of times the utilization of these benefits is specifically if you have some medical incident and you need family medical leave, which we didn't talk about that in the Family Medical Leave Act. If you have short-term disability, if you have any kinds of health leave, we set individual meetings with those employees. Oftentimes their spouses come in, we help, there's paperwork that has to be filed. We walk them through that paperwork, and so we do have individual meetings with them. During COVID, that became, we've been open the entire time during COVID, but sometimes people weren't comfortable. We've gotten better at doing Teams meetings and things like that. But we do face-to-face meetings to walk them through those processes.
Gotcha.
Here.
Cool. And then my last thing is, I don't know if this might be a bigger question, so maybe it's just a reminder for people that it exists. But I think often when you are filling out forms at the doctor's office, and it'll ask for multiple insurances. And so if you do have a situation where you're two people are working and they both have insurance, and then, how is that negotiated, or how do people kind of figure out, if I'm covered under my school district plan, but I'm also covered under my spouse's plan because they have an affordable plan or whatever, what are sort of the benefits of that, or how do people kind of go about understanding that?
Well, so it does get a little bit complicated when you have that, and it really happens in situations where one of the employers has a pretty cheap spouse coverage before it's going to be a difference. But what happens is when that claim comes in, there's going to be a primary and a secondary insurance. And so your primary is going to be your insurance that you're the one, you're not the dependent on, that you're the insured. And on that primary, and so they're going to cover first. But then what happens as the big benefit can be is that whatever is not covered by that primary then gets submitted as a claim to the secondary. And oftentimes that covers the rest of it, type of deal. So it's all a coordination of benefits that happens. And you guys, if you have it, whenever you have a claim, a medical, a dental, or a vision claim, there's this form that you'll get in the mail or you'll get emailed that's called an EOB, which is explanation of benefits. And that form then actually shows your claim, shows which doctor it was, shows what the total cost was, tells you if there was any contractual adjustments to that cost, like maybe the doctor charged you $1,500, but their contract with the insurance company was only $1,200. So there's gonna be $300 taken off. And then how much is deductible, how much is copay, how much is the insurance gonna pay, and how much you're gonna pay. So when you have double insurance, if you will, that then gets complicated because your first EOB comes from your primary, and then that same other number then goes to the secondary insurance, and it walks through the same kind of process, and you then have double coverage. So if you were paying full boat at both places, it probably doesn't make sense. But in fact, one of my supervisors had that exact same situation where her spouse has cheap insurance for the dependents, And they've just always had it. And she has double coverage and oftentimes pays nothing when she goes to the doctor.
Yeah. Okay, cool. Yeah. I feel like that's always something that's like on the form. And I'm like, I've never had double insurance, but I was curious if that was common. So cool. Well, like I wish I had you explain all of this to me when I signed up for benefits, some odd years ago. So I think this will be really helpful as just kind of an intro for our students as they are entering into the workforce, and hopefully it also kind of inspires them to go ask questions to their HR department as they come up and they're kind of making some of these decisions around, which plan to choose, if that's an option, even for things like you mentioned with a dental, that they have an option and that kind of thing. So this was so helpful. We really, really appreciate you taking the time to do this for us, and also the salary schedules from a couple of weeks ago. So we just thank you so much for your time. It's been really helpful.
It's my pleasure.
Awesome. Well, thank you so much. And yeah, we'll maybe reach out about potentially doing this again next year if you're up for it.
Perfect. Absolutely.
Awesome. Thanks so much, Dave. Have a good rest of your day.
Okay, maybe we can do it live sometime. Maybe we could get
that'd be really great.
That'd be nice. Okay.
Hopefully things go back to normal soon.
Yeah. Okay. Thank you.
Yeah. Have a good one. Bye.
Bye.